Hi, I'm Madam Z. Welcome to Madam Z and Friends podcast. First of all, before I get started, I want to say thank you so much. A huge shout out to Purple Lava Coffee for sponsoring my podcast. I have the pleasure of introducing you to my guest. Don't do that. Dominique,
Hello.
Dominique McIntosh. She's a
Yes.
little shy, but listen, wait until you hear about this powerhouse right here. Dominique, do me a favor. Tell our audience exactly what it is you do. What's your field?
I'm a nurse practitioner and I'm now doing like home health. So doing home visits where I go out to people's homes, mostly elderly, and do their annual wellness exams.
I didn't even know that. What?
Yes.
Okay. So let's walk this back just a couple of steps. First of all, what made you even think about medicine?
So my dad is a nurse and my aunt is a nurse. And so I just been around like people that have been in the healthcare industry. And I really also just love helping people. So it was like something that came natural to me. So when I was in high school, I volunteered at the VA with my dad doing women's health. And I really fell in love with it. And I knew that I just wanted to be a nurse when I grew up. Yeah.
Wow. Okay, so that's not it. Let me tell you something. Nurse, RN, that's one thing. This young lady here, tell them what you are.
I'm a nurse practitioner.
And what exactly is a nurse practitioner?
So a nurse practitioner, so I went to school and got my bachelor's for 4 years, and then I went back to school for another 2 years and got my advanced nurse practitioner license. And so I'm able to see patients on my own with the oversight of a physician. I'm able to write prescriptions, and it just gives you a little bit more autonomy as, more than a nurse. So, yeah.
So she's really, really being nice about this. She is like, I'm going to say in my words, she's like the equivalent of a physician. Yes, you are supervised, and yes, you have someone an attending to make sure that you're on point. But with the amount of experience that you have and the knowledge, that's equal to a physician because you can actually write prescriptions.
Yeah, I can actually see my own patients, write prescriptions, do basically the same thing that a doctor does. Like when I was in the urgent care, I worked in the urgent care for 5 years. And when I was in the urgent care, I seen about maybe 30 to 40 patients by myself. And then just every quarter, like the doctor would just review the charts and just make sure that everything looks good. But I was in the clinic by myself seeing patients. So, yeah.
Wow, that's a huge responsibility.
It
Am I
is.
correct?
It is. It
Yeah.
is.
What would you recommend for someone who wanted to get into this field? What would you tell them? What are the first steps that they need to do?
I would say actually to ask someone to shadow them, to honestly just see if you really, is it something that you really would love to do? Because people just say they want to be a nurse, but I feel like sometimes people just say that because of the money or just because they see the life that a nurse is living. But I would actually just follow in their footsteps, because honestly, at first, I was contemplating between being like a doctor or being a nurse, but I shadowed an obstetrician, and just looking at their work-life balance, like just being always on call and things like that. That's when I decided that honestly, I would actually like being a nurse better, just so I can have a little bit more work-life balance and being at home and being a mother and things like that. So yeah, I would say start off with just shadowing, and then just if you really like it, then just apply to different nursing schools and figure out which one is the best fit for you. So yeah.
How would someone determine a school and if it's the right one for them?
I would say based the school on like the class size. Also look at the pass rate. That's very, very important. Because at the end, after you're finishing your 4 years, you have to take a national test, and some schools don't have really good pass rates. So looking at the amount of people that actually complete the program, and then actually take the test and pass it. Also deciding if you are able to. Some schools are just a lot like online. If you're able to handle working online versus just being in person, like I learn better by listening to someone like in person. Like if I'm on the computer, I'm not really focused on, or absorbing the information as well. So just figuring that out, like what works best for you. Like if you have to work and maybe online works best for you, then that's, the path that you should take. But just trying to figure out sorting those different things out.
That's a lot.
Yeah.
That's a huge undertaking. In terms of medicine itself, given where it started, where it is now, do you see any changes coming within the future?
Just using integrating more technology. Um, and it's actually like a good thing, I would say. Just like how, like I worked in the emergency room at Emory for like about 10 years, and just seeing like how technology progressed. Like say if you have a stroke patient, then some of the times like the world-renowned stroke surgeon or a doctor, a neurologist, they will be online, and you just bring the camera, bring the TV into the room, and the doctor will be able to talk to the patient, talk to the other doctor, to the ER doctor that's there. And that was like so helpful for the patient. The neurologist couldn't be there, but he was still giving his expert opinion, different things like that. I feel like technology is just really improving and helping the field of medicine. Yeah.
And I think it's also changed within surgery in the operating room.
Yeah, exactly. Yes, and using robots to do surgery, like giving people like doing things laparoscopic, or just just because they're using the robots rather than just having to make longer incisions, so people are having like less recovery time, different things like that. So yeah.
Wow. Oh
Yeah.
my gosh, that's a lot.
Yeah.
We're going to take a quick break, and what I want to do is I'm going to ask a couple of trivia questions. Of course, it's going to be about nursing, and then we'll come back to you. So let's see. Let me put my glasses on, trying to be cute here. Okay.
Oh Lord.
I'm working on this. Oh, come on, you've got this.
Are these trivia questions, are we being recorded for the trivia questions as well?
Yeah, of course.
Lord.
What is CPR short for?
I don't know what that is. See, you put me on the spot. I can't.
So I'm going to give you a choice.
Okay.
Chest press resuscitation,
No.
clinical pulmonary resuscitation, cardiopulmonary resuscitation.
Cardiopulmonary resuscitation.
See, told you she knows. Oh, how about this one? Two more.
Lord.
Who was the first female nurse? Was it Florence Hummingbird? Was it Florence Bluebird? Was it Florence Nightingale?
Florence Nightingale.
See, she's up. See, and okay, this one. Yeah. What was the name of the hospital where American medical drama ER, emergency room, was set? Was it City Hospital, Chicago General Hospital, County General Hospital?
Oh, I never watched that show.
Yeah.
I know I know they recorded it in New York, correct? So was it County General?
County General Hospital.
Okay.
Ah, cute. I like that. Look at her. Shoot. Over here worrying about this stuff. Tell me something. Do you teach classes?
So I taught a couple of IV classes to upcoming physicians and PA students at Emory. And so I would just, and also like infection control. So basically like teaching them how to don and doff off like the hazmat suits and different things like that, and how to put on gloves properly when they're doing like sterile fields, and how to start an IV.
What's an IV and what's don and doff? I don't know what that is.
So putting on like protective gear, like when you're going into certain patients' rooms,
okay.
different things like that. And then starting the IV, like when you need a catheter to infuse like fluids, or give blood or receive blood, different things like that. So
okay.
Yeah.
Have you thought maybe somewhere in the future, maybe teaching college level?
Maybe just like as an adjunct teacher, like just maybe just going in sometimes and just teaching on a specific subtopic or something like that. But I'm pretty shy, so I don't know.
I don't know about this. So speaking of that, medicine is so broad.
Yes.
And I heard you say women's health.
Yes.
What specifically in women's health is your focus?
So I don't focus now in women's health, but I just like to, just overall just women's wellness care, like just doing annual like pap smears, teaching women about doing mammograms and performing the mammograms and things like that. But I just did that just when I was doing like my rotation. But I honestly just specialize mostly in the emergency room, and then just like I said, urgent care. And now just doing like, this is more what I'm doing now, is like doing like more preventative health. So basically helping someone to like, I'm checking medications of the elderly patients, making sure they're taking the medication that's prescribed, making sure that, like, hey, if you have high blood pressure, are you taking high blood pressure medicine? If you have high cholesterol, are you taking high cholesterol medicine? Are you taking your cholesterol medicine at night? You know, like, because it's more effective, like different things like that, doing more patient teaching and more patient education. And I actually really love it because I love doing like educating people about their health. So, yeah.
So I wonder if we would see you somewhere in the future in one of the community centers.
Yes, I think I would like that better. Yeah.
Okay.
Yeah.
Huh. Ding, 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 ding. MadameZ for the count.
For the win.
Yeah. Okay. So let's connect because I'm an educator, first and foremost. So if I wanted, or I had a student who was getting ready to graduate from high school, what core classes in high school are transferable in the field?
So, of course, something like biology. You can take if your school offers like anatomy, physiology, that's definitely a great class to take. Like sociology. And I would say sociology. You're looking at me like the sociology,
like,
just know how people think and how, like, like trying to, like, I feel like that's a huge part of medicine, because a doctor can sit there and tell someone something, but if they're not coming across in a certain way, a patient is not receptive to that information. Like, I've heard patients say, like, wow, you really explained that really well to me. Like, I wish my doctor would have told me that, or different things like that. Just like having good communication skills with the patient, or establishing a good rapport with your patients. I feel like that goes a long way. What other subjects? Math. Math is pretty important, just because like dosage calculation, like you have to figure out the dosage of different medications to give to patients, especially if you're dealing with like pediatric patients. Those medications are pretty much like weight based.
What type
yeah.
of math classes would you have to, should one focus on?
I would say algebra. Like basic algebra, nothing like, yeah.
Like, I
just know, like, yeah, it's just basic algebra, nothing too deep.
Oh, I can't even figure the basic. Oh my God! So it's true. Oh my goodness! Now I always figured
like to find
add,
out,
subtract,
yeah,
multiply,
but if
divide,
you know those,
fractions.
But common sense would help with a lot of that stuff too. Just like if you're like hanging like a heparin drip or something like that on a patient, and you're trying to figure out their weight and changing it to, to kilograms, and trying to figure out the calculation of how fast the drip needs to go every hour, different things like that. But that's basic algebra, yeah.
Basic algebra to somebody who doesn't even know. Like, oh my goodness, I feel like a loser here, but okay.
No, but yeah,
Man,
the science
awesome.
classes are very important.
Wow, so science, math,
chemistry, yeah.
Chemistry, oh my gosh. That's awesome though. You're smart. Yeah, you didn't get this far by being a numbnut. Definitely not. Oh my goodness. Okay, so let me go to more trivia questions. Come on, trivia.
Lord. Can't we just leave it at 3 when I got 100? Like, yeah.
Okay, two more. Oh, this one. What are the 4 primary vital signs? You want me to give you the options? So
okay, blood pressure.
Okay.
Heart rate. Is that on there?
Keep going.
Oh, temperature. And your oxygen saturation.
Like, wow, okay, what do I, let me not do this anymore. This is pretty embarrassing. Sheesh. All right, so I'm going to stop there. I want you to tell a student, someone who's leaving high school and who definitely knows that this is a field that they want to go into. What are your 2 top pieces of advice for them?
To never give up. That'll be one. If you fail a class or you feel like you can't do it, you can just keep going, keep pushing forward. That'll be my top advice. Don't let anyone tell you not to or that you can't do it. Another bit of advice, just give it your all. Just do the best you can and just go as hard as you can in the field. Yeah.
Is it something where we definitely need A's versus C's?
I would say
And why?
within your prerequisites, you do need to do as best as you can, because then when you're applying to nursing school, it's competitive. And so that's why you want to have good grades going into nursing school. And when you get in nursing school, you just want to try your hardest so that you retain the information that you're the best nurse that you can be. So I would say to strive for A's and B's, but hey, if you get a C, and brush it off and just try harder next time.
Okay.
Yeah.
All right. I want to say, number one, thank you so much for taking the time out of your
Thank
busy
you.
schedule. Because let me tell you, this woman is married, she has kids, she has a full-time career, and then you're teaching on the side. You've got all this other stuff going on. So that meant you took time out of your busy, hectic schedule to come and
Oh, no
do my
problem.
podcast. I really appreciate
No
it.
problem.
Thank you so much.
No problem.
Maybe
Thank
we can
you.
get your other half to come.
Yes.
Get him to come on. But I want to say thank you so much. And hopefully those of you who are watching, you were able to come to some type of a decision as to whether or not this is a career for you. Thank you for tuning in on MadameZ and Friendz podcast. See you next time.
Bye.